Welcome to The Parent Guide, helping your teen overcome pornography addiction. The podcast where we tackle this tough topic with compassion and practical solutions. I'm Matt Bulkley, a psychotherapist who, for the past 25 years, spent working with teens and their families navigating challenges like pornography addiction. And if you've discovered that your teen is struggling, probably feeling overwhelmed, unsure of where to turn, or even hesitant to bring it up, and I want you to know you're not alone and that there's hope. I see it happen every day. In this episode, we're exploring outpatient support. In past episodes, I've talked about 3 levels of intervention. First being parent-led intervention, which we talked about in the last episode. Today, we'll talk about outpatient support, which is that middle level of intervention. And then the next episode, we'll cover residential level out-of-home support, like our Star Guides program. As far as outpatient support, it is a structured yet flexible approach that empowers teens to break free from addiction. And if you've come to the conclusion that they need more support and intervention than what you can provide as a parent, perhaps you've tried a parent-led intervention and realized that your teen's emotional or mental health needs require professional help beyond what you can provide. Or maybe you realize that they need an outside source of accountability rather than you for working through relapses. But the situation is still manageable, meaning that it doesn't make sense to be considering placement in a residential level program, so that your teen is able to remain at home, go to school, live their life, and develop skills to beat the impulse to fall into these patterns of addiction. Let me share a quick scenario that I recently encountered. The mother's named Sarah. She had noticed that her 16-year-old son, Alex, had started to become more withdrawn and secretive, spending many hours on his phone late at night. And after discovering that he was accessing pornography regularly, she tried addressing it through conversations and setting stricter screen time rules. But despite her efforts, Alex's behavior didn't change, and he became defensive when confronted. And she felt overwhelmed and realized that Alex's emotional struggles, his feelings of shame, his difficulty managing impulses required more support than what she could provide at home. And after researching options, considering ruling out a parent-led intervention, she decided an outpatient program would be the best fit. So he could stay at home, attend school, maintain his daily routine while still receiving professional support. She did some research, found a great outpatient therapist that works with teens, provides weekly therapy sessions that would include her in the process with periodic family therapy sessions, and was willing to communicate with her about the treatment, and was willing to even use the recovery toolbox in the treatment process. The program provided Alex with external source of accountability, help him to process relapses without it relying solely on his mom, Sarah. And she reports that over time that Alex is developing skills to manage his impulses, and she noticed that he's becoming more open and confident. The outpatient approach allowed Alex to address his addiction while staying connected to his everyday life and giving his mom, Sarah, hope for his recovery. So over the next 30 minutes or so, I'd like to break down how outpatient works, why it can be effective, and how you, as a parent, can support your teen's journey to recovery. Plus, share another case story that might hit close to home and answer some common questions that parents ask about outpatient. So take a deep breath and let's get started. Before we dive into the intervention of outpatient support, let's just refresh memories, talk about why pornography addiction is such a unique challenge for teens. As a psychotherapist, I've seen how adolescence is a critical time for brain development and the development of neural pathways. The teen brain is like a sponge, soaking up experiences that shape its reward pathways. And when a teen gets caught in a cycle of pornography use, it can rewire those neural pathways, making it harder for them to find joy and fulfillment in everyday activities or to manage impulses or urges. And this might show up as your teen pulling away from family, isolating themselves from others, struggling in school, or dealing with anxiety or depression issues. But the good news, with the right support, teens can break free and build healthier habits. And this is where outpatient support would come in. And this is the process of seeking professional help as you have concluded that more support is needed than just a parent-led intervention. And it's designed for motivated teens who want to overcome pornography addiction, often alongside other challenges like depression or anxiety or ADHD. Now, keep in mind, pornography addiction is not considered or listed as a formal DSM diagnosis, but it's often viewed more as a maladaptive form of coping with these other issues. And usually the primary diagnosis is going to be depression or anxiety or attention deficit disorder or an adjustment disorder from the standpoint of a medical or an insurance standpoint. And that is how the treatment would be defined and documented. But a vital part of that treatment process would be disrupting the maladaptive form of coping through using pornography and replacing it with healthy coping skills. And rather than a residential placement that can be several months out of the home, expensive, outpatient treatment lets the teen remain at home. And rather than pulling the trigger on a residential level program, it gets you expert help in the home. You may have noticed that I said for motivated teens. For unmotivated teens, getting them to participate in outpatient support can be challenging. And in some cases, the only effective option will be a residential level placement. But if your teen wants to change and is open to help, then outpatient support can be very effective. And it's built on three main forms of service delivery: individual therapy sessions, weekly recovery groups, and the evidence-based recovery toolbox curriculum. So let's start with individual therapy and explore how it works. So individual therapy is really the heart of outpatient support. Looks like this: your teen sitting down with the licensed therapist, like me, someone trained in addressing compulsive behavior patterns like pornography addiction. These sessions are a confidential space where your teen can open up about their thoughts, their emotions, and their triggers without any fear of judgment. As a therapist, I use proven methods like cognitive behavioral therapy, or referred to as CBT, to help teens build self-awareness, to unspot healthy patterns, including helping them to discover that they're more than likely using pornography as a maladaptive form of coping, as an escape from the negative emotions in their life. For example, a teen might realize that they're turning to pornography when they're feeling stressed out about school, or after an argument with you as a parent, or if they're feeling lonely. Another example would be helping a teen to discover the phenomena that occurs when they have a streak of multiple days without a relapse into pornography, and then they slip, and the discouragement and the shame that they feel from the end of a streak leads them into what I often call a tailspin, where they then have several days of relapse because they're so focused on the fails rather than seeing the bigger picture and helping them to change the way that they keep score and to recognize that even with their relapses, that they're actually making progress. Through therapy, they learn practical coping skills, like a technique we call urge surfing, which is where we help them to be more aware, to notice the urge to view pornography, to acknowledge it, but then to write it out like a wave without acting on it. Just because you get the urge or the impulse doesn't mean that you have to act on it. And they might be taught to use this and then also other skills like to practice deep breathing, to get into the habit of journaling, to identify what it is that's driving that urge. Therapy sessions become a safe place to analyze relapses. I let my teen clients know that I want them to report their efforts every week during session, whether they've avoided relapses or whether they've relapsed every day. And then we explore what is working and what is not and create strategies for the upcoming week. And I think that there's value for the teen to know that every week that they're expected to make an accounting of their relapse effort. And without that consistent accountability, achieving a recovery is much more difficult. Now, ideally, this could occur with parents in a parent-led intervention, but for many, reporting their weekly accountability for relapses is very difficult with parents, and they find it easier, less uncomfortable to use therapy sessions for that purpose. Every individual session is focused on assessing and understanding the teen's unique needs, giving them a personalized roadmap to make better choices and to become more resilient. Now, parents, this is where your teen starts to gain control over their actions and their emotions. And it's not about shaming them, it's empowering them to understand themselves and to make lasting changes. So let's move to the next piece, which is weekly recovery groups. So weekly recovery groups are all about building community and accountability. And these are small groups of teens facilitated by a trained professional where they can share their experiences, their challenges, and their victories in a safe place. And I've seen firsthand how powerful it is for a teen to realize that they're not alone in this struggle. I've been running a recovery group at our office in St. George, Utah for the past 10 years. Some weeks We might talk about how to handle triggers like stumbling across something online or sharing what is working for them, like a new hobby that keeps them engaged. These groups cover practical skills that are so critical for recovery. For example, we teach media literacy, how to critically evaluate the content that teens see online and social media, recognize what might pull them back into unhealthy habits. They also learn emotional regulation skills, how to build healthy relationships. Now, finding a teen recovery group is challenging, and I am not aware of many that exist around the country. I do know that there are some in northern Utah, and I know that there are some churches around the country who run teen groups, but from what I can tell, they seem to be few and far between. And so if you're aware of therapists, counselors, pastors, clergy in your areas around the country that are interested in starting a recovery group, I would love to consult and help them get it started, provide recovery toolbox, curriculum, and consulting. I think it's a much needed intervention and sorely lacking from what I can tell. Now, if you're local in the St. George, Southern Utah area, our in-person group is ideal. And I love it when I have face-to-face team clients in the office for the group. And it is most effective that way. But for a lot of families who don't have access to a recovery group nearby, we've added the online recovery group to our Tuesday 4 p.m. Mountain Time group, and we run it via Zoom. And it's a fantastic way for teens all around the country to connect with peers struggling with the same issues and get support from wherever they're at. You can find more details about the recovery group on the website at therapyassociates.com. And over the years, some of my teen clients have attended and participated for years at a time. Some attend for a few months, gain skills and confidence, and then move on. The length of time they participate is really highly individualized based on the need. One topic that does come up a lot in groups is boundary settings with technology. Teens share how they are learning to limit screen time, how they're learning to be more submissive to content filters and recognizing the value of parental controls and limits on technology. And parents, you can reinforce these at home because it's about creating a team effort where everyone's working towards the same goal of recovery. And in the early stages of a recovery, it's vital. It's nearly impossible for a teen to achieve a recovery without some parental intervention as far as boundaries with technology. And this is something where you need to work together with your teen, and if you have a professional involved, to find the right fit, the right strategies to be able to put the boundaries in place that will help your teen to be successful. Now let's talk about how parents fit into this process with family therapy. Family therapy, a key piece of outpatient support, and parents, this is where you come in. Pornography addiction doesn't just affect your teen, it affects the whole family. And in family therapy, you, your teen, and the therapist will work closely together to check in on progress, improve communication, tackle these challenges like finding the right management of technology arrangement. I've had sessions where we brainstorm ways to create tech-free zones in the house or practice having tough conversations without shutting down. There are also parent-only sessions where you get coaching on how to support your teen. Common concern that many parents have is how to handle ongoing relapses and learning to be patient with the process of recovery because it frequently takes longer and includes more setbacks than they anticipate. And talking this through with the therapist can be helpful for parents and provide realistic but hopeful perspective. One tip that I often share is to focus on connection over correction and to analyze and not catastrophize. Instead of jumping in to fix problems or resisting the urge to impose consequence or to conclude that my teen is not trying hard enough, instead, try asking your teen, how are you feeling about things right now? And this opens the door to understanding without making them feel judged. These sessions help you to set healthy boundaries like limiting screen time, strengthening your family's connection. As a parent, you might feel like you're navigating uncharted waters, but family therapy gives you the tools to create a supportive home environment. It's about rebuilding trust and showing your teen that you are in their corner. Now let's move on to the recovery toolbox for teens, which we have talked about in previous episodes, but ties it all together. So the recovery toolbox curriculum, it includes the Breaking Free Teen Workbook, the Breaking Free Parent Guide, and the 101 Tips for Quitting Porn Workbook. These are the backbone of the outpatient approach. They're research-based curriculums that are designed specifically for teens and their parents, and merged together, they cover 10 vital concepts that we have researched to be the most essential aspects to achieving a recovery. In the curriculum, we cover teaching how pornography addiction runs in a cycle, how it affects the brains, how it affects the brains and relationships. For example, teens learn how repeated exposure can overstimulate the brain's reward system, hijack the neurochemicals, making it harder to feel satisfied with everyday activities. They learn how patterns of using pornography develop into temporary forms of escape from learning how to deal with hard emotions that they may be facing. Through interactive workbook exercises, they develop skills like improved self-regulation, critical thinking, impulse control, and healthy coping mechanisms. One exercise asks them to reflect on their values and how their choices align with them. For parents, the curriculum offers practical skills like communication strategies and boundary setting frameworks. You learn how to have calm, constructive conversation about technology and even set up a family media plan. It's all about empowering your teen with knowledge and giving you the confidence to support them. So let me pause here to just share a case that really brings this to life. Recently heard from a mom named Karen. Her 16-year-old son was struggling with pornography addiction, and she felt lost until they started to do outpatient therapy and started using the recovery toolbox. And through individual therapy, her son learned to identify and manage his triggers, which in part was tied into stresses from overuse of social media. And the recovery groups gave him a sense of community and connection with others struggling. Family therapy helped Karen and her husband to begin rebuilding trust with their son. And they worked together to put in a technology management plan that everybody agreed on. And now, months later, Karen says that her son is more confident and is getting better grades at school and is not relapsing into his previous addictive patterns. And her advice to other parents, she says it's okay to feel overwhelmed at first. Just take the first step, ask for help. Stories like Karen show what's possible when teens and families get the right support. Let's wrap up with some common questions that parents sometimes ask about outpatient therapy. So I get questions from parents about how to get started. So let's talk about two big ones. First, how do I find a therapist to work with my teen in outpatient therapy? So finding the right therapist can feel daunting, but it is worth the effort. Looking for someone who specializes in teen addiction recovery and takes pornography addiction seriously is going to be vital. Now, 3 issues here. 1, not all therapists work well with teens. A second, not all therapists that work with teens are willing to include you as the parent in the treatment process. And then third, not all therapists view the problem of pornography the same way. So some see it as developmentally normal, but if you're concerned, you're going to want someone who shares your perspective, and you're going to want a therapist that will include you in the treatment process and communicate with you and include you in family therapy as part of the treatment plan. Ask if they're familiar with the recovery toolbox, the Breaking Free workbooks. And if they're not, find out if they're willing to incorporate it into the therapy, as it's a proven framework for addressing this issue. Now, don't be afraid to make calls and ask around and find the right fit. And I'm always happy to connect with therapists in your area and introduce the recovery toolbox and how they can implement it into the treatment process. Now, if you're here in Utah, you can start by checking out our clinical team at the therapyassociates.net website. And we have multiple clinicians in the office that work specifically with teen pornography addiction issues. And to just tell with that, a second question, can you work with my teen via telehealth or Zoom at Therapy Associates? And the answer would be, we would love to, but it really depends on state licensing laws, which can be a bit complex. So here's the best practice. If you are able to travel and visit us here in St. George, Utah, then we can do an initial in-person assessment and draft a treatment plan and do some initial therapy sessions to get the treatment process started. And then often we can continue to do telehealth video sessions via Zoom for ongoing and follow-up with periodic returns to our office for check-ins. Now, if travel isn't an option, then your best bet is to find a therapist in your area that's willing to use the recovery toolbox. But you could use our online recovery group to augment that We run that group every Tuesday at 4 p.m. Mountain Time. And it's considered a support group, not a formal therapy group. So it is less restricted by state laws, and it's open to teens anywhere. And it can be a great supplement to individual therapy sessions. So again, visit our website at therapyassociates.net to learn more details about the recovery group. Parents, we're almost out of time for today, but I did want to leave you with this, that you have the power to help your teen overcome pornography addiction. And outpatient support can be a key in that. It's flexible, it's evidence-based, it's designed to empower both your teen and your family. Individual therapy provides personalized strategies. Recovery groups offer peer support and accountability. And the Recovery Toolbox curriculum equips everybody with practical tools. So if you're ready to take the next step, head to our website, learn more about outpatient programs, get the Recovery Toolbox in the bookstore. At the top of the website, a link called the bookstore, and in the bookstore, you'll find the Recovery Toolbox. It's the toolbox for teens. It's the blue one. The brown one is for the adults. So get the blue one. You don't have to have all the answers. Just take the first step. And if this episode helped you, please share it with other parents who might need to hear it. Subscribe to this podcast for more episodes on helping your teen overcome pornography addiction. Check out our YouTube channel. Check out our parent library on the blog page at Therapy Associates, where you'll find hundreds of articles and tips on supporting your teen's recovery. Until next time, let's stay connected and know that you're doing an important work. In the next episode, we will jump into a deep dive on the most intensive level of intervention, the Star Guides program.